Hi everybody, welcome to Dr. Manny's YouTube Learn Shops, and this is the final component of the health assessment in an adult, which incorporates the neurological system. First and foremost, some of the clinical manifestations that can be seen as anomalies in the neurological system are general mood, behaviour, whether you're depressed, angry, whether you've had a concussion, headache, loss in strength of muscle tone, coordination, speaking difficulties, dysarthria, memory problems, strange thoughts and actions, learning difficulties, to state a few. When it comes to the physical assessment in respect to the neurological system, it's important to remember that the nervous system is the major controlling, regulatory and communicating system in the body. It's the centre of all mental activity, which includes thought processes, learning and memory. It's got two main components: the central nervous system, which is made up of the brain and the spinal cord, and the peripheral nervous system, which is an extension and branches off from the spinal cord to extend to all the body parts. Again, it's always important to remember history. History is the precursor to physical assessment. So therefore, questions that relate to family, past and lifestyle could include: have you ever been diagnosed with a neurological problem? Do you have or have had? And this could include things like neuromuscular disorders, seizures, epilepsy, head injury, certain diseases like Parkinson's disease, multiple sclerosis, myasthenia gravis. Cardiovascular disorders such as hypertension, stroke, coronary artery disease, cerebral vascular disease, renal vascular disease. It could incorporate endocrine disorders such as diabetes mellitus, infections such as meningitis, encephalitis, myocarditis, mental health issues that relate to anxiety and stress. Common clinical manifestations when we look at the neurological system could include headache or other neurological pain, weakness in a single limb or one side of the body or generalised. This could include involuntary movements or tremors, which can occur in issues such as Parkinson's disease. There can be difficulty with balance, coordination or gait. There can be dizziness or vertigo, difficulty in swallowing, dysphagia, changes in intellectual abilities, which probably could relate to things like Alzheimer's disease, difficulties with expression or comprehension of speech or language, alteration in touch, taste or smell, loss or blurring of vision in one or both eyes, diplopia such as double vision, photophobia in relation to bright light sensitivity, hearing loss or sounds in your ears, tinnitus. What's some of the equipment that might be employed by a healthcare provider when assessing the neurological system? Well, a pen light or a flashlight, a tongue blade, a cotton swab, sometimes a tuning fork, a reflex hammer, and supplies for cranial nerve testing, things like assessing olfactory nerve cranial 1. What are some of the abnormal findings in the level of consciousness? Well, first of all, when you enter a room, there should be a spontaneous reaction. Level of consciousness is assessed in that way. When you assess it, you should be using normal voice tones. When asking the patient's name or opening their eyes, a loud voice may get no response whatsoever. Tactile is where you're touching the patient, typically lightly, or in some instances maybe noxious stimulation creating pain to elicit a response. There are certain tools that can be used, as we've mentioned in other sessions, such as the AVPU scale, or here, this one, the Glasgow Coma scale, which can assess the level of consciousness. When we test the cranial nerves, typically now it includes observing near and far vision, assessing pupil constriction and extraocular movements, assessing the corneal reflexes, especially if the level of consciousness is acutely impaired. You observe facial expression, facial strength, and sensation. You can observe the uvular rise with the R gag reflex test. You can observe tongue movements when assessing for dysphagia. You can assess alertness and attention span. You can assess whether the pupils are equal and reacting to light and accommodating. You can assess whether their gag reflex and corneal reflexes are positive. Also, facial strength. All of these we assessed previously in other learn shops. Muscle strength testing can be important as well, and this is where you observe and palpate muscle groups to check for any atrophy. And this we reviewed in the musculoskeletal assessment learn shop. Commonly, however, the groups that are tested could be the deltoids, the biceps, the triceps, the hamstrings and the quadriceps. And we can assess muscle strength by asking the patient to move their extremities or selected muscle groups both independently and against resistance. There are grades for everything. Muscle power can be assessed from 0 to 5. 0 being no contraction seen, 5 being normal. We can also assess cerebellar function, and this relates to specific tests which can be used to assess this function. This can include gait and balance testing, pronator drift, the finger to nose test, a rapid alternating action, and the heel to shin test, which are all indicated in the diagrams in front of you. When you evaluate the walk, gait, balance, you ask the patient to walk down a corridor, and the points to observe are they walking smoothly, the position of their feet, the height and length of the step, the symmetry of the arm and leg movement. You ask the patient to walk on their heels and toes, and then tandem walk, for example, heel to toe in a straight line. You can perform the Romberg test, which denotes sensory ataxia as a cause of their postural imbalance. The sensory pathway involves proprioception, which basically means that even with your eyes closed, you know where your body part is. The finger to nose test, this is where you ask the patient to touch the tip of the examiner's finger with the tip of his or her forefinger, and you test each hand separately. Then they touch their own nose, and this is repeated several times. The pronator drift test is where you ask the patient to close their eyes and then hold both arms straight out in front with palms facing up. And you observe this for 20 to 30 seconds. The patient should be able to maintain the position of both arms equally if their motor pathway is intact. A positive pronator test basically means this is an indication that there is muscle weakness abnormal function in the corticospinal tract, upper neuron disorders in the brain, spinal cord issues in certain areas. This is typically a test that is done for a patient with a suspected stroke. The rapid alternating action test assesses rapid alternating movements, and this is where you instruct the patient to slap his or her thigh with the palm of their hand and then back as fast as possible. Up, down, up, down, up, down. The heel to shin test assesses the lower extremities, and this is where you ask a seated or supine patient to take the heel of one foot and without deviation move it steadily down the shin of the other leg. You can also evaluate sensation. Light touch, this is where you can use a cotton swab and ask the patient to close their eyes, and you apply it to the skin and you ask the patient whether they can feel it or not. If okay, the patient correctly identifies the light touch. Pain sensation can be evaluated as well, and this is where you can break a tongue blade, for example, or use a cotton swab that has got a sharp end. You ask the patient to close their eyes and lightly touch the patient's skin with the sharp end, and the patient is asked whether they can feel the sensation. If they can feel it, pain sensation is intact. When evaluating the sensation related to temperature, this is done, but only if the pain and touch is abnormal. And what you do is you use one prong of a tuning fork that's been warmed with the hands, or you can have test tubes containing warm or cold water. You ask the patient to close their eyes and you touch the skin with the warm or cold objects. You have the patient identify when he or she can feel warm or cold. If they can feel it, the temperature sensation is intact. Point location is asking the patient to close their eyes, and you use a finger and you gently touch the patient's hand, lower arms, abdomen, lower legs or feet, and you have the patient identify where they can feel the sensation. You don't cue the patient by asking, do you feel this? You just wait till they inform you. You observe the areas of sensory loss, you compare side to side. If identified, point location is intact. Then you've got vibration as far as sensation goes. You strike a low-pitched tuning fork on the side or the heel of your hand, and you ask the patient to close their eyes, and you hold the fork at the base and you place it over any body prominence, beginning with the most distal. If sensation is felt at the most distal, no further testing is required. Ask the patient to state where the sensation is felt and when it disappears. To stop, dampen the tuning fork by pressing it on the tongs. Vibration sense is intact. Then you've got stereognosis, and this is evaluating sensation again. You ask the patient to close their eyes and identify a familiar object. It could be a coin, a key placed in the palm. The patient correctly identifies the object. Everything is okay. Graphesthesia, this is where you use a blunt object to trace a number or a letter on the palm of the patient's hand, and you ask them to identify what the number is or what the letter is. There's another sensation evaluation called the point or the 2-point discrimination test. And this is where you ask the patient to close their eyes. You hold a blunt end object 2 inches apart. You move them together until the patient feels them as 1 point. The fingertips are the most sensitive, where the upper arms and thighs are the least sensitive. There is more discrimination distally than centrally, meaning that distally on the toes or the fingertips. Deep tendon reflex testing. This is where you test the biceps, triceps, brachioradialis, patella and the Achilles tendon. And typically these reflexes are observed for symmetry when tested bilaterally, and they're tested for briskness in movement. The deep tendon reflexes are graded as follows: 0, no response; 4, very brisk. And the reflexes response depends on the accurate location of the striking area over the tendon. So have the patient flex the muscle to find where the tendon is and then relax it for testing. Deep tendon reflexes are typically 2. Here you can see the deep tendon reflexes testing areas: biceps, triceps, brachioradialis, patella and Achilles. Then you can also test the plantar response, which is a superficial reflex test. You stroke the sole of the foot with a blunt instrument, for example, the edge of a tongue blade or the end of a tendon hammer. You apply the stimulus firmly but gently to the lateral aspect, beginning at the heel and stopping at the base of the toes. The toes should flex, a flexor-plantar response. An abnormal response is the toes fanning upward, which is called the Babinski sign. Other superficial reflex testing could be the abdominal response. And this is where on the upper abdomen, and this is to identify whether there are issues with T8 to T10 in the upper quadrants of the abdomen. And what should happen is the umbilicus moves towards each area of stimulation symmetrically. Depression or absence of this reflex may result from a central lesion, obesity, lax skeletal muscles, or a spinal cord injury. The lower abdominal, this is now testing the integrity of T10 to T12, and this is where you stroke the lower abdominal quadrants with a tongue blade or a reflex hammer edge, and the umbilicus moves towards each area of the stimulation. And same again, depression of the or absence indicates there could be issues related to a central lesion, obesity, lax skeletal muscles, or a spinal cord injury. Disorders related to the neurological system include paralysis, tremors, certain abnormal positions such as the decerebrate or decorticate position, quadriplegia, paraplegia, or hemiplegia. Other disease processes could involve Parkinsonian issues, cerebellar ataxia, sensory ataxia. It could involve things like having a tic, clonus myoclonus, dystonia, abnormal movements, referred to as coriform movements. That's the end of the neurological session. Thank you. If you found these sessions to be of any benefit, please recommend them to your colleagues, your friends, and subscribe so that you can get additional Dr. Manny Learn Shops notifications. Take care and God bless.